A recent survey of 500 medical doctors by the Professional Providence Society says doctors are losing confidence in the future of the healthcare system as well as in the future of their profession in the country. The 2014 survey revealed a confidence level of 43% in the future of the healthcare system in South Africa over the next 5 years, down 3 percentage points from the previous quarter. Well, Health Minister Aaron Motsoaledi recently stated that the rise in medical malpractice claims has reached crisis proportions, suffocating practitioners. Well, Macy Seperepere is a manager for professional associations at PPS. She joins us now to talk about that survey. Macy, good afternoon. Thanks for coming in.
Good afternoon. Thank you for having me.
Well, if anything, this survey really reiterates what doctors in the private and the public sector are feeling. There's a decline in morale and confidence in the system, and I suppose the survey says it again.
Yes, there has been a decline, but I think for now we shouldn't panic as much as people are probably thinking. There's hope. I think once we're highlighting the issues and hopefully working with the different medical associations and working with the Department of Health, there can be solutions that can be met, that can be derived in making sure that we don't have such a severe loss of skilled professionals in the medical profession.
Let's talk about what the possible solutions could be. But before that, one of the biggest gripes I see reflected in the survey is the fact that we have a very poor set of nursing skills in the country. Doctors say we need to change that. Is it an issue of very few nurses going into these jobs or the quality of training?
I think the quality of training, it wasn't such a big issue with a lot of the doctors. The biggest issue was more like access, like the making sure that we have enough professionals coming through the system. And I think making sure that we've got enough medical and the nurses coming through. A lot of medical services, medical professionals are not coming through the system. Some of the issues might be because, we've got a decreased number of maths and science students coming through the education system, and that could be a factor into that as well. But looking at how we can actually ensure that we make sure that the training of the nurses itself is one of the issues that they needed to address, that they feel needs to be addressed. And I think addressing, making sure that we have got nurses in specialized services and critical nursing issues, nursing services, we can make sure we've got the right nurses and the right training coming through in the support of the medical doctors.
Now, a couple of weeks ago, it dominated headlines when the Health Minister, Aaron Motsoaledi, spoke about the claims doctors face when it comes to malpractices. It's hurting the industry. I mean, if you look at neurosurgery alone, an increase of claims by 573%. What's the feeling among the doctors in this survey as far as the solution is concerned to this problem?
I think in the survey, we don't necessarily ask them for solutions. We just ask them, what are their gripes? What are the issues? What things do they feel like there's confidence growing or there's confidence declining in certain issues? When it comes to I think it's media legal claims, the issues that come up there is because they feel that a lot of doctors are going to be afraid to specialize in those specific professions because of the claims coming through and because of the cost of actually insuring yourself to make sure that when the claims do come through, you can pay the claims as a doctor. And I think a lot of the doctors are finding that financially straining, and they might end up not wanting to specialize in those specific professions.
The other big cloud that hangs over the doctors, and we've seen this in recent years, in recent months in particular, is the issue of the national health insurance. Many doctors complaining that they're not connected to the progress of the way this is evolving. What's the sentiment in the survey about the NHI?
The survey, they all feel like because they still, sitting in a situation where they're not sure, is the NHI going to be applied? Is it not going to be applied? How soon is it going to be applied? And how is it going to actually impact on their income? Those are the issues that are coming up from the survey. And I think with time and with engagement between the different departments and with the medical associations, there might be a solution, there might be common ground that might be met, and maybe sentiments might be sort of calmed in the process.
All right, we're going to have to leave it there. Macy Seperepere, the manager for professional associations at PPS. Yep. Thanks indeed for coming in.
Thank you very much for having me.